Steve Contorno did a deep dive into connections between Trump's administration and Project 2025. And Steve found that at least 140 people who had worked in the Trump administration had a hand in Project 2025, including half of the people listed as authors, editors, and contributors to its big 900-page manifesto document. And Steve wrote that includes 6 former Trump cabinet secretaries, 4 people he nominated as ambassadors. One of them is former ICE chief Tom Homan, who Trump keeps saying as recently as this week he plans to give another prominent role in a next Trump administration. And that's not all. Steve also found that dozens of additional former Trump officials hold positions with other outside conservative groups that are advising Project 2025. So the total connections he found is at least 240 people formerly in Trump's administration involved or connected in some way.
I'm just going to go over some parts of Project 2025's website. Goal number 3, promoting stable and flourishing married families. Families comprised of a married mother, father, and their children are the foundation of a well-ordered nation and healthy society. Unfortunately, family policies and programs under President Biden's HHS are fraught with agenda items focusing on LGBTQ+ equity, subsidizing single motherhood, and disincentivizing work and penalizing marriage. I don't know of any circumstance when President Biden has penalized marriage. Policymakers should end taxpayer funding of Planned Parenthood and all other abortion providers and redirect funding to health centers that provide real health care for women. The next administration should take particular note of how radical gender ideology is, having a devastating effect on school-age children today, especially young girls. Immediately end its collection of data on gender identity, which legitimizes the unscientific notion that men can become women and vice versa. It encourages the phenomenon of ever-multiplying subjective identities. Reissue a stronger transgender national coverage determination. They should acknowledge the growing body of evidence that such interventions are dangerous and acknowledge that there is insignificant scientific evidence to support such coverage in state plans. Investigate, expose, and remediate any instances in which HHS violated people's rights by discrimination on the basis of sex includes but not limited to discrimination on the basis of sex stereotypes, sex characteristics, including intersex traits, pregnancy or related conditions, sexual orientation, and gender identity. In other words, the department proposes to interpret Section 1557 as if it created special privileges for new classes of people defined in ways that are highly ideological and unscientific. The next president should issue a series of executive orders requiring an accounting of how federal programs and grants spread diversity, equity, and inclusion / critical race theory gender ideology, saying this quota practice should be ended and the NIH Office of Equity, Diversity, and Inclusion, which pushes such unlawful action, should be abolished. Policies should be repealed and replaced by policies that support the formation of a stable, married, nuclear family. Healthy marriage and relationship education program. Utilize funding or grants to provide state-level high school education resources and curriculum on healthy marriages, sexual risk avoidance, and healthy relationships. Allow child welfare funding to be used for marriage and relationship education. Provide educational information on healthy marriage and relationships, family planning clinics. Reinforce definition of marriage and family. All other family forms involve higher levels of instability, financial stress or poverty, or poor behavior, psychological or educational outcomes if the marriage is not a heterosexual intact marriage. Department of Health and Human Services. Goal number 1, protecting life, conscience, and bodily integrity. Furthermore, lists created in the past have given priority to sex promotion textbooks. HHS should create a list of criteria for evaluating the sort of curriculum that should be selected for any sex education grant program. Respect for life and conscience. The CDC should eliminate programs and projects that do not respect human rights and conscience rights and that undermine family formation. It should ensure that it is not promoting abortion as healthcare. Problematically, the CDC presented itself as a kind of super doctor for the entire nation. The CDC is a public health institution, not a medical institution. Well, medical is involved in public health. It should fund studies into the risks and complications of abortion and ensure that it corrects and does not promote misinformation regarding the comparative health and psychological benefits of childbirth versus the health and psychological risks of intentionally taking a human life through abortion. Wow, what a way to word that. Liberal states have now become sanctuaries for abortion tourism. They should use every available tool, including the cutting of funds, to ensure that every state reports exactly how many abortions take place within its borders, at what gestational age of the child, for what reason, the mother's state of residence, and by what method. The CDC should require monitoring and reporting for complications due to abortion in every instance of children being born alive after an abortion. Comparisons between live births and abortion shall be tracked across various demographic indicators. Abortion pills. Abortion pills pose the single greatest threat to unborn children in a post-Roe world. The rate of chemical abortion in the U.S. has increased by more than 150% in the past decade. More than half of annual abortions in the U.S. are chemical rather than surgical. Reverse its approval of chemical abortion drugs because the politicized approval process was illegal from the start. Rescind these contracts and establish an advisory committee that is compliant with, has members that are committed to women's preventative services and are not pro-abortion ideologies. The Secretary should pursue a robust agenda to protect the fundamental right to life, protect conscience rights, and uphold bodily integrity rooted in biological realities, not ideology. Mail-order abortions. Allowing mail-order abortions is a gift to the abortion industry that allows it to expand far beyond brick-and-mortar clinics and into pro-life states that are trying to protect women, girls, and unborn children from abortion. The FDA should therefore stop promoting and approving mail-order abortions in violation of long-standing federal laws that prohibit the mailing and interstate carriage of abortion drugs. The HHS should promptly restore the Ethics Advisory Committee to oversee abortion-derived fetal tissue during research, and Congress should prohibit such research altogether. End intramural research projects using tissue from aborted children within the NIH, which should end its human embryonic stem cell registry. Woke policies. NIH became so focused on the #MeToo movement that it refused to sponsor scientific conferences unless there was a certain number of women panelists, which violated federal rights laws against sex discrimination. Create certification pathways for non-clinical laboratories and researchers. The COVID-19 pandemic revealed that the U.S. needs to leverage the expertise of non-clinical laboratories. Life agenda. So eliminate the HHS Reproductive Healthcare Access Task Force and install a pro-life task force to ensure that all the department's divisions seek to use their authority to promote the life and health of a woman and their unborn children. Yep, that's a quote. Should be reversed in all HHS and CMS programs. This includes the Children's Health Insurance Program. Low-income families who rely on this program should not be coerced, pressured, or otherwise encouraged to embrace this ideologically motivated sexualization of their children. Prohibit abortion travel funding. Prohibit Planned Parenthood from receiving Medicaid funds. Propose rulemaking to interpret the Medicaid statute to disqualify providers of elective abortion from the Medicaid program. Abortion is not healthcare, and states should be free to devise and implement programs that prioritize qualified providers that are not entangled with the abortion industry. Withdraw funds for states that require abortion insurance or that discriminate in violation of the Weldon Amendment. So it's basically saying like local government should not discriminate against pro-life health entities or insurers. Congress should pass the Born Alive Abortion Survivors Protection Act to require the proper medical care be given to infants who survive an abortion and to establish criminal consequences for practitioners who fail to provide such care. In pregnancy prevention program. Both programs should ensure that there is better reporting of sub-grantees and referral lists so that they do not promote abortion or high-risk sexual behavior among adolescents. In addition, certain provisions should be employed so that these programs do not serve as advocacy tools to promote sex, promote prostitution, or provide a funnel effect for abortion facilities and school field trips to clinics or for similar purposes. Any list with approved curriculum or so-called evidence-based list should be abolished. Eliminate the Head Start program. Head Start, originally established and funded to support low-income families, is fraught with scandal and abuse. Research has demonstrated that federal Head Start centers which provide preschool care to children from low-income families have little or no long-term academic value for children. Will restore Trump religious and moral exemptions to the contraceptive mandate. The contraceptive mandate issued under Obamacare has been the source of years of egregious attacks on many Americans' religious and moral beliefs. The mandate was issued as a part of the Women's Preventative Service Guidelines. They're saying that ensure that training for medical professionals and doulas is not being used for abortion training. One of the emergency contraceptives, Ella, is a progesterone blocker and can prevent a recently fertilized embryo from implanting in the woman's uterus. HRSA should eliminate this potential contraception from the contraceptive mandate. Investigate state medical school compliance with the Coates-Snow Amendment, which prohibits discrimination against healthcare entities that do not provide or undergo training for abortion. Ensure that the ACGME complies with all relevant and that states have taken the affirmative steps by issuing regulations to ensure compliance. Communicate to medical schools that any abortion-related training must be an opt-in rather than an opt-out basis. Focus on root cause analysis with a focus on strengthening marriage and sexual risk avoidance. Strong leadership is needed in the Office of Science and Medicine to drive investigative review of literature for a variety of issues, including the effect of abortion on prematurity and breast cancer, lack of evidence for so-called gender-affirming care, and physical and emotional damage following cross-sex treatments, especially on children. They should withdraw all recommendations of and support for cross-sex medical interventions and gender-affirming care. They would serve as the lead on all matters of federal domestic policy development related to life and family, with support from the DPC for implementation and coordination among agencies. Under liberal administrations, OCR has passed a poor record of devoting services to religious freedom enforcement and often complicit in approving or looking the other way at administration's own attacks on religious liberty. They should create a dedicated special representative for domestic women's health. The representative will provide a clear focal point for all issues related to protecting life and serving families. Secretary should proudly state that men and women are crucial to the advancement of life sciences and medical care, that married men and women are the ideal natural family structure because all children have a right to be raised by the men and women who conceived them. A family planning program should be reframed with a focus on better education around fertility awareness and holistic family planning. They should eliminate religious discrimination and religious freedom of healthcare workers and guarantee the right of conscience and religious freedom of healthcare workers. HHS should rescind the Biden administration's regulation and reinstate the Trump administration's regulation for the program. Do this quickly. And expand the potential grantee population beyond abortion providers like Planned Parenthood. Congress should complement these efforts by passing legislation, such as the Title X Abortion Provider Prohibition Act, which would prohibit family planning grants from going to entities that perform abortions or provide funding to other entities that perform abortion. OCR should withdraw its pharmacy abortion mandate guidance that pharmacies and pharmacists have the right to not participate in abortions, including pill-induced abortions, if doing so would violate their sincere moral or religious obligations. Moreover, no federal civil rights laws preempt state pro-life statuses. OCR should withdraw its Health Insurance Portability and Accountability Act, HIPAA, guidance on abortion. That is extremely dangerous. HIPAA covers patients in the womb, but this guidance treats them as a non-persons contrary to law. The guidance is necessary and contributes to ideological, motivated fear-mongering about abortion after adoption. Policy agenda. This book is an invitation for you, the reader, Mr. Smith, Mrs. Smith, and Ms. Smith, to come to Washington or support those who can. Our goal is to assemble an army of aligned, vetted, trained, and prepared conservatives to go to work on day one to deconstruct the administrative state. Safeguarding civil rights. Enforcement of civil rights should be based on a proper understanding of those laws, rejecting gender ideology and critical race theory. Congress should pass and the next president should sign a Department of Education Reorganization Act and make changes to the income-driven student loan program. July 12, 2022, the Biden Education Department seeks to gut the hard-earned rights of women with its changes to the department's regulations, implementing Title IX, which prohibits discrimination on the basis of sex in educational programs and activities. The new administration should take the following steps. Define sex to mean only biological sex recognized at birth, and strengthen protections for faith-based educational institutions, programs, and activities. On its first day in office, the next administration should signal its intent to enter the rulemaking process to restore the Trump administration's Title IX regulation. Sex is properly understood as a fixed biological fact. At the same time, the political appointees in the Office for Civil Rights should begin a full review of all Title IX investigations that were conducted on the understanding that sex referred to gender identity and/or sexual orientation. All ingoing investigations should be dropped. So they want to immediately commence rulemaking to rescind the equity in IDEA regulation. President Biden has proposed a new income-driven repayment program that would be extremely generous to borrowers requiring only nominal payments from most students. It would turn every policy level to the most generous setting on record. Administration must end the prior administration's abuse of the agency's payment pause and HEA loan forgiveness programs, including borrower defense to repayment, closed school discharge, and public service loan forgiveness. Students must defend the false idea that America is systemically racist, the theory actively disrupting the values that hold communities together, such as equality under the law and colorblindness. As such, lawmakers should design legislation that prevents the theory from spreading discrimination. Furthermore, school officials should not require students or teachers to believe that individuals are guilty or responsible for the actions of others based on race or ethnicity. Transparency around program performance and DEA influence, diversity, equity, and inclusion. No public education employee or contractor shall use a name to address a student other than the name listed on a student's birth certificate. No public education employee or contractor shall use a pronoun in addressing a student that is different from the student's biological sex. Protect faith-based institutions by prohibiting accreditation agencies from requiring standards and criteria that undermine the religious beliefs of or require policies or conduct that conflict with the religious mission or religious beliefs of the institution, and intruding on the governance of colleges and universities controlled by a religious organization. Thanks for listening. I'll probably go through another section next week. If you're interested in any other sections, let me know.